Okay. So the last thing which we need to discuss here is capsule of thyroid gland. So let's read the points. You have something known as true capsule, and that use as pseudolobules, septums, and these septums carry vascular nerves and lymphatics, right? And you have got something known as false capsule. A false capsule, it's written that pretracheal fascia, right, loosely adherent. And next you have Berry's ligament, that is condensation of PTF, that is pretracheal fascia. What is the pretracheal fascia? It is nothing but it is a deep cervical fascia itself, where in the posterior medial it condenses. And this Berry's ligament is written that attached to the cricoid and upper trachea, tracheal rings. Okay, and let us understand what exactly it is. Okay, see, this is a thyroid. This is a thyroid gland. Okay, the first thing we need to understand, you have got something known as a true capsule and the false capsule, right? You got a true capsule or the false capsule. See, you can look into this. This is the adherent point, right? This is a thyroid and this is adherent point. This is the one which is adherent to the thyroid is a true capsule. So if you look into this, this is a thyroid. This is a thyroid. Okay, this is a transverse section which you have taken, and this is adherent to the thyroid. That is a true capsule. True capsule. And this true capsule, what does it do? It forms a pseudolobules. That means it has a septations, right? It has a septations. It forms something known as pseudolobules, and these septations pass into this thyroid, right? They have, and it creates a lobule, it creates a thyroid as it has lobules in the thyroid, and that is the reason we call this as pseudolobules. It is responsible for pseudolobules. And these septations, right, these septations which are passing from the true capsule, and it has its own, right, it has its vascular, and this septation has got an vascularity, it has nerves, it has lymphatics. Okay, it has lymphatics. So that is the reason whenever you dissect the thyroid, you should be very careful. When you tear the thyroid, when you tear this true capsule, it bleeds. So that is the reason we need to be very careful. And you have gotten another a capsule. You can see this another capsule which is covering the thyroid, and this the one which is outside. This is a false capsule. This is false capsule. So you can look into the transverse section. I drew this is a false capsule. Okay, so what is a false capsule here? It's nothing but you have a fascia, right? You have a fascia. If you look into this is a trachea, right? This is a trachea. You have a fascia in the cervical region, and which is deep, and you call that as deep cervical fascia, right? Deep cervical fascia. And this deep cervical fascia, right, it covers the thyroid. It covers the thyroid. Covers, you can see this. This is the covering of the aspect, right? This is covers the thyroid, and this is a false capsule. And this false capsule is loosely adherent. Remember that it is a false capsule. This is loosely adherent. And the next important aspect which you need, that is Berry's ligament. What is Berry's ligament? You can look into this aspect. This is the thyroid, right? This is a thyroid gland. Okay, this is a thyroid gland. Okay, this is a thyroid cartilage, right? Thyroid gland, and this is a trachea. Okay, now this posterior tracheal, sorry, this is a pre-tracheal. Pre in the sense, this is a pre in the sense before the trachea. You have a fascia. This pretracheal fascia, it condenses. Remember this. Okay, it condensation of the pretracheal fascia, and this is attached to the, where it is attached, it is attached to the cricoid cartilage and the upper tracheal rings. Upper tracheal rings. So you have got, this is a cricoid cartilage, this is the upper tracheal rings. So that is the reason the swellings, right, the swellings of the thyroid, okay, the swellings of the thyroid, it moves with deglutition. Why it moves with deglutition? Because during swallowing, this larynx, right, larynx moves upwards till the epiglottis, so that there will be closure of that during the swallowing as well. So whenever you swallow, the thyroid is swelling, the thyroid which is attached to the cricoid and the upper tracheal rings by this Berry's ligament, this also moves up. So that is the reason during swallowing, the thyroid swellings, right, they move with deglutition. So that's the basic concepts we need to understand regarding the capsule of thyroid gland. And the next important point, we need to understand about the blood supply of thyroid. And remember that it is a most vascular. And how much vascular? When do we, why it is most vascular, or why it is not as high blood flow? Because per ml, 4 to 6 ml per minute per gram. So if I have already explained, it is around some 20 grams. Okay, 20 grams. So for each gram, right, each gram per 1 minute, 4 to 6 ml blood flow. So it's a high blood flow, right? It's a high blood flow. And the next thing is arterial, right? Next is arterial. So what is the supply of the arterial supply? You have a superior thyroid artery and you have an inferior thyroid artery, and you have got thyroid ima. And what is a superior thyroid artery? Where it is branched, it's written that external carotid artery. Inferior thyroid artery is a branch from thyrocervical trunk from subclavian artery. Thyroidema directly from aorta. And it's also written that innominate 2%. And the next important point here is, it's also written, we'll be discussing about the venous drainage, right? Superior thyroid vein, you have an internal jugular vein. Middle thyroid vein, internal jugular vein. Inferior thyroid veins, that is a brachiocephalic vein. And the next important is something known as, right, during medialization of thyroid gland it bleeds. So let us understand what is it trying to tell us. So this is a beautiful diagram which we need to understand regarding blood supply of the thyroid. The blood is supplied, right, mainly by superior thyroid artery and the inferior thyroid artery. And remember that the superior thyroid artery, it is branch of, right, it is from the branch, it's the first branch of external carotid. You can look into this is the carotid artery. This carotid artery gives a branch, or this is an external carotid artery and the internal carotid artery. The first branch of the external carotid artery is the superior thyroid artery, where it comes. And remember that before entering into thyroid, it branches off, right, anterior and the posterior. And the second blood supply is from inferior thyroid artery, and this inferior thyroid artery, right, from where does it comes? From where does it comes? It's coming from the where thyrocervical trunk, right? You have got, this is a cervical region. You have a cervical thyroid to the thyroid. Remember, cervical to the thyroid gland, thyrocervical trunk. A branch coming from this thyrocervical trunk. In turn, it's a branch of what? It's a branch of subclavian artery. Subclavian artery. It's very simple to understand. So you can look at it. This is the arch of aorta, and you have got a subclavian artery. There, this subclavian artery, it gives a branch known as thyrocervical trunk, and this thyrocervical trunk gives an artery that is inferior thyroid artery. It's a bilateral. It's not. It's like an right and the left you have. Right and the left you have. Now, this is found in most of the people. Say, example, in 2% of the people, a thyroid ima. This is what? This is a thyroid ima, right? ima. It is directly from the aorta. Remember, it's directly from the aorta. And it is found in 2% of people, just a 2% of people. That's the basic blood supply. Now, what is the venous drainage here? The same thing related. You have a superior thyroid artery, same you have superior thyroid vein. You have an inferior thyroid artery, same inferior thyroid vein. But the thing here is, you have got something known as middle thyroid vein. The superior thyroid vein and the middle thyroid vein, remember that it drains into the internal jugular vein. Right? We'll be discussing from where the internal jugular vein comes out, right? But try and you understand the superior and the middle, the drain into the internal jugular vein, right? And the inferior thyroid vein, this is inferior thyroid vein, whereas it drains into the brachiocephalic vein. That's very simple. Brachiocephalic vein. So ultimately the superior thyroid vein and the middle thyroid vein, the drain into the internal jugular vein. The inferior thyroid vein, it drains into the brachiocephalic vein. That is the reason during the medialization of the thyroid gland, whenever you medialize the thyroid gland, okay, we need to understand you have a middle thyroid vein that can rupture and it can bleed. So we need to be very careful in this while you during the dissection of the thyroid gland, when you medialize the thyroid gland, right, medialize the thyroid gland, it can bleed. That's all you need to understand, right, as of now. Thank you.